A very good morning, everybody. Today's topic is the rectus sheath, and this topic we will study under the following headings. Number one, the mode of formation of the rectus sheath. Number two is the boundaries of the rectus sheath. Number three is the contents of rectus sheath, and in the contents of rectus sheath, we will discuss about two important muscles. Number one is the rectus abdominis muscle. Number two is the pyramidalis muscle, and finally we will add a note on the applied anatomy of the rectus sheath also. So let's move to the rectus sheath. Now this rectus sheath, it is nothing but it is an aponeurotic sheath which envelopes the rectus abdominis muscle on each side of the linea alba. And not only that, this sheath acts as a retinaculum and prevents the muscle from bowstringing. Bowstringing means which will not allow the muscle to pop out or to protrude out. Now here, as you all know that the flat muscles like external oblique, internal oblique, transverse abdominis, now these muscles, which we call them as the flat muscles of abdomen, now these muscles, when you see, these muscles will be ending up in an aponeurotic sheath. Now the aponeurotic fibers of these three flat muscles of abdomen will form the, what do you call, the rectus sheath. And you know, there is one more term which we come across just now is the linea alba. Now what is this linea alba? Which is nothing but, you know, this is a fibrous line, which is a fibrous line or a fibrous band which is seen in the anterior abdominal wall, which is formed by, you know, the decussation or the interlacement of the aponeurotic fibers of the three flat muscles, which which is attached above to the xiphoid process, and below it is attached to the pubic symphysis. This is what the linea alba exactly mean. Now the mode of formation of the rectus sheath. Now I request everyone to be focused at this point, which is very important. Now the concept of the formation of this rectus sheath occurs as follow. Number one, it is by splitting of the aponeurosis of internal oblique at the lateral border of rectus muscle. Number two is the splitting extends from the costal margins to the midway between umbilicus and pubic symphysis. Below this, the internal oblique does not split and passes together with the transversus aponeurosis in front of the rectus abdominis muscle. And number three is above the costal margins, this internal oblique muscle does not extend. Therefore, the sheath is different at different levels. This is the sagittal section of the rectus sheath. Now in this slide you are seeing the layers from anterior to posterior. If you observe, you are seeing the first one, which is the skin. Then you have a yellow color structure, which is the fatty layer, superficial fascia fatty layer, which is called as Camphor's fascia. Then we have this red line, which is called as the membranous layer of superficial, which is called as the fascia scarpa. Then we have the green line, which is the external oblique aponeurosis. Next to that, we have the orange color line, which is the internal oblique aponeurosis, which is extending, you can see, posteriorly from the costal cartilages to the midway between the umbilicus and pubic symphysis. Next to that, you have the dark blue color structure. This is the fascia, aponeurosis of transversus abdominis. Then we have the rectus abdominis muscle. Okay, these are the layers you see in the anterior abdominal wall. Here, if you more concentrate on this orange color line, which I told you, the aponeurosis of internal oblique. Now what is the point? It says the internal oblique splits into two layers. One is anterior and posterior, between the costal margins and from the costal margins and midway between umbilicus and pubic symphysis. Now if you see here, this anteriorly, this line is not extending above the costal cartilages. Even posteriorly also, the orange line is not extending above the costal margins, above the costal, so that this internal oblique aponeurosis is not extending above the costal margins. in the same way, if you see below, posteriorly this line is ending at this green color arc which is called as arcuate line, and below that there is no internal oblique is extending, but anteriorly below this umbilicus, the what do you call this orange color line which is the internal oblique aponeurosis is extending anterior, but posteriorly it is not present. Okay, so this is the extension of the internal oblique aponeurosis. So internal oblique aponeurosis is split into two layers, and these layers are extended between the what do you call the between the costal margins above and midway between the umbilicus and pubic symphysis, and below that the internal oblique does not split and passes together with the transversus aponeurosis in front of the rectus abdominis muscle. The boundaries of the rectus sheath presents anterior and posterior walls, medial and lateral margins. So we have two walls, one is anterior wall, posterior wall, and we have two margins, one is medial, number two is lateral margins. Now the anterior, we'll talk about the anterior wall. See here, the anterior wall of the rectus sheath is complete. That means it is completely covering the muscle. So the anterior wall is complete and it is entirely fibrous tissue, but it differs in thickness at different levels. Now, if you see the thickness of this anterior wall, it is not same throughout its extent. The thickness is different at different levels. Now, how we will see. Now, above the costal margins, the wall is thin and formed only by the aponeurosis of external oblique. Next, from the costal margins to the midway between umbilicus and pubic symphysis, the wall is thicker and it is formed by anterior layer of aponeurosis of internal oblique and aponeurosis of external oblique. That means the anterior wall between the costal margins and midway between umbilicus and pubic symphysis, if you see at this point, the anterior wall is thicker because it is formed by the aponeurosis of external oblique and as well as the anterior layer or anterior lamella of internal oblique aponeurosis. Thirdly, from the lower end of the what do you call the previous extent to the pubic symphysis, if you see, the wall is thickest and it is formed by the fusion of aponeurosis of all the three flat muscles of abdomen. That means it is the lower part of the anterior wall of rectus sheath, if you see, that means which is extending from the midway between umbilicus to pubic umbilicus and pubic symphysis to the pubic symphysis. If you see, the anterior wall is thickest because it is formed by the layers, the aponeurosis of external oblique, aponeurosis of internal oblique, aponeurosis of transverse abdominis. Okay, and not only that, the anterior wall of this rectus sheath is adherent to the rectus abdominis muscle by means of the tendinous intersections, and these tendinous intersections they are present, one at the xiphoid process, one at the umbilicus and one midway between them. The posterior wall of rectus sheath, it is incomplete. It is not like that of the anterior wall. The anterior wall of rectus sheath, as I said, it is complete. It completely covers the anterior part of the rectus abdominis muscle. But where you see the posterior wall of rectus sheath, it is incomplete and it is only present from the costal margins to midway between umbilicus and pubic symphysis. And when you see, the wall is composed mostly of fibrous tissue and it is formed by the posterior lamella of aponeurosis of internal oblique and the aponeurosis of transversus abdominis. Okay, so the posterior lamina of internal oblique muscle and the aponeurosis of transverse abdominis muscle. Both they blend with each other and forms the posterior wall of the rectus sheath, extending from the costal margins to midway between umbilicus and pubic symphysis. And here one important point which you need to know is the lower extent of this wall presents a free margin, or you can say the lower end of this posterior wall presents a free margin which is known as arcuate line. The arcuate line, which is also called as the linea semicircularis, which is nothing but it is an horizontal line which concave downwards, and it demarcates the lower limit of the posterior wall of rectus sheath, and importantly the inferior epigastric artery enters this rectus sheath in front of the arcuate line. Now the posterior wall below the arcuate line, if you see, the posterior wall is deficient and the rectus muscle is directly lying on the fascia transversalis, which separates this rectus abdominis muscle from the extraperitoneal tissue and the parietal peritoneum. And next, if you see the posterior wall above the costal margins, the wall is again deficient and this rectus abdominis muscle directly it rests on 5th, 6th and 7th costal cartilages. So the posterior wall of rectus sheath is only present between, it extends from the costal margins to the midway between umbilicus and pubic symphysis. Okay, and it is absent below the arcuate line, it is absent above the costal margins also. I think you all people know what is arcuate line. Arcuate line is nothing but which is the the free margin, which is the free margin, lower free margin of the posterior wall of rectus sheath. Okay, so the posterior wall is entirely free from rectus abdominis muscle, because anterior wall is more adherent to the rectus abdominis muscle by the tendinous intersections, but whereas the posterior wall is free from the muscle. That means the muscle can be separated easily from the posterior wall of rectus sheath. So this is all about the walls of rectus sheath. So anterior wall of rectus sheath is complete, whereas the posterior wall of rectus sheath is incomplete. Anterior wall, it completely covers the muscle, whereas the posterior wall, it only covers the muscle between costal margins to the midway between umbilicus, and above the costal margins you don't have any posterior wall, below the arcuate line you don't have any posterior wall, so that the posterior wall of rectus sheath is incomplete. Yeah, the medial margin is formed by the linea alba. I already mentioned you what is linea alba. Linea alba is nothing but which is an vertical fibrous band which is produced by the interlacement or decussation of the aponeurotic fibers of three flat muscles of abdomen, which is very narrow at the umbilicus and which is wider above it. So below the umbilicus it is very narrow and above the umbilicus it is wider. Okay, it is present in the midline of the anterior abdominal wall, and if you see the attachments of this linea alba, it is attached above to the tip of the xiphoid process of the sternum, and below it is attached to the pubic symphysis. And not only that, this linea alba it presents two expansions. One expansion which is called as the suspensory ligament of penis, and number two is which has got a triangular expansion which is attached to the pubic crest, and this is called as the adminiculum linea alba. The lateral margin it is formed by the linea semilunaris. Linea semilunaris is nothing but which is a curved fibrous line extending from the pubic tubercle to the tip of the ninth costal cartilage, and the anterior ramus of lower 6 thoracic nerves enters the rectus sheath after crossing this line. And next thing, surgical, it is very important that any incisions on the anterior abdominal wall along the linea semilunaris is not a wise idea, because it may produce segmental paralysis of rectus abdominis muscle due to the injury of lower thoracic nerves. So whenever there is an incision has to be made to the anterior abdominal wall, any surgical incisions, that should not done through the linea semilunaris, because it may cause the damage to the nerves which are entering into the rectus sheath and supplying to the muscles. And if that nerves are damaged, ultimately the rectus abdominis muscle is lead to injury, and that causes the paralysis. Okay, so that is about the linea semilunaris, which is the lateral margin of the rectus sheath. Now coming to the contents of the rectus sheath, the rectus sheath contains muscles, vessels, nerves. The muscles, number 1 is rectus abdominis, number 2 is pyramidalis, and the vessels are inferior epigastric vessels and superior epigastric vessels, and the nerves are lower 5 intercostal nerves and subcostal nerves. These are the contents of the rectus sheath. Now the rectus abdominis muscle, this is a long strap muscle which is wider above and narrow below, and the origin of this muscle, if you see, it arises from two heads. From below it arises. One is medial head, which arises from the anterior surface of the pubic symphysis, and the lateral head, which arises from the lateral part of the pubic crest and the pubic tubercles. And this muscle is inserted by 4 fleshy slips, and the most medial slip is attached to the xiphoid process, anterior surface of xiphoid process of sternum, and the remaining 3 slips are attached from lateral to medial side to the 5th, 6th and 7th costal cartilages. Now after knowing this origin insertion of this rectus abdominis muscle, one should know about the peculiarities of the rectus abdominis muscle. So what are the peculiarities? Now this rectus abdominis muscle, it is presented with 3 tendinous intersections, as I mentioned before also, and these tendinous intersections, they are present, one at the tip of xiphoid process and one at the umbilicus, and one is on the midway between this. That means one is at the xiphoid process, one is at the umbilicus, and one will be in between, in the midway between this. So occasionally sometimes you may also see the 4th intersection which is present below the umbilicus. Now each intersections, if you observe, they are horizontal in zigzag manner, and it is attached to the anterior wall of rectus sheath. That is the reason the anterior wall of rectus sheath is more adherent to the rectus abdominis muscle. Due to the presence of these tendinous intersections, the rectus sheath is attached to the muscle, whereas the posterior wall of rectus sheath is free. Now not only that, why these intersections are present? So what is the importance of this? Importance in the sense, like why they are. Now this is like, these intersections are representing the segmental tissues. They are the segmental, they represent the intersegmental tissues between different myotomes, and in fact these intersections appears secondarily to divide the long muscle into the small shorter segments to provide the strength to the muscle. And here one more thing is also, now between these intersections, the part of the muscle is, it gets more prominented when you do abs nothing but the abdominal muscle exercise. When you do between these intersections, you see the muscles will get pop out. So between one intersection and other intersection, the rectus abdominis muscle pops out and becomes more prominent, and which we call as the six pack. If the person has got 3 intersections, then we get six pack, one on right side and left side we get 3 3 6. If occasionally if he has got the 4 intersections, we get the 4 segments more prominent, and that we name as the 8 pack. This is about the peculiarities. And coming to the nerve supply of this muscle, the rectus muscle is supplied by the lower 5 intercostal and subcostal nerves. Now, what is the action of this muscle? So this muscle action, they provide protection to the abdominal viscera from external injury, and compress the abdominal cavity and maintain the intra-abdominal pressure, and also they produce the flexion of the vertebral column. So protection, then maintaining the intra-abdominal pressure, and also produce the flexion of the vertebral column. These are the actions of the rectus abdominis muscle. Now the next muscle of the rectus sheath, which is the pyramidalis. Now pyramidalis muscle, which is a triangular or pyramidal in shape, and this origin of this muscle, it is taking origin from the pubic symphysis and the pubic crest, and insertion of this muscle, it is inserted by its apex onto the linea alba, midway between the umbilicus and pubic symphysis. And the nerve supply of this muscle is from the subcostal nerve. Action of this muscle is, it is a tensor of linea alba, and the peculiarity is, sometimes this muscle may be absent on one or both sides. So this is all about the pyramidalis muscle. Now finally coming to the upright anatomy of this rectus sheath. Now if there are the weak abdominal muscles, or if there is any weak point in the abdominal muscle, that results in the herniation. So we have different types of hernias, like umbilical hernia, where the small intestine will be herniated around the umbilicus, and not only that, the epigastric hernia is also seen, and not only that, we have the posterior rectus sheath hernias, where you see the severe abdominal pain and also obstruction of the small bowel. And not only that, we have one condition also which is called as the rectus sheath hematoma. So this rectus sheath hematome is nothing but which is the accumulation of the blood in the rectus sheath, and which causes pain in the abdomen. And not only that, it is caused due to the rupture of the epigastric vessels or by the muscular tear. Okay, this is the condition which is called as rectus sheath hematome. Not only that, we also have one more thing which is called as rectus sheath abscess also, which is due to the trauma to the abdominal wall. These are the few clinical conditions which we can discuss in this region of rectus sheath and anterior abdominal wall. So with this we conclude the topic rectus sheath. And in the rectus sheath, more importantly, one should know about the formation of rectus sheath, how the anterior wall is formed, how the posterior wall is formed. And the next thing, coming to the contents, in the contents you should also know about the rectus abdominis muscle with its origin, insertion, nerve supply, action. Thank you.